right, welcome back. Well, we know Kentucky has a love of horses, but the relationship between horses and humans, believe it or not, has more of a connection than you might think when it comes to medicine. And here to tell us more about some of the similarities between human and equine health, we're pleased to welcome Dr. Lori Shook, a neonatologist at Kentucky Children's Hospital. Thank you so much for being with us today.
Thanks for having me.
And we were just talking a little bit during the break about how in the last several years, you've started learning more about horses yourself, but you also have seen some professional links in between horse medicine and human health.
Right. I first started riding about 5 years ago and wanted to learn what could possibly go wrong with my horses. But I think as a neonatologist, I really became intrigued on a field trip out to Rood and Riddle and seeing their full intensive care unit and how state-of-the-art it is and how the diseases were very much the same. There's a foal there that had meconium aspiration syndrome, which is very common in human babies and treated much the same way, although they have to take economics more into account than we do.
And what are some of the other things and forms of disease that are common both in humans and horses? Horses can get a lot of the same illnesses that people do, right?
They do. Gray horses in particular are very prone to get melanomas. And there are some estimates that up to 85 or 90% of them will have melanomas by the time they're 20 years old. The difference is that it doesn't tend to become systemic or metastasize in horses like it does in humans. Very deadly disease in humans, but horses tend to live for a long time with it. So they can be a source of research for us to figure out how to treat humans better.
You mentioned some of the differences with economics. What other things in treatment did you notice that is done differently between horses and humans? Maybe something that is done better with horses than is with people?
Well, I think one of the things that I noticed was like meconium plugging syndrome. It's fairly common in babies, and we end up having to transport them to level 3 nurseries and get, kind of high-tech enemas and things like that. And with horses, the vet just comes out and takes care of it with an enema and goes away, and the horse gets up and eats. And, we turn it into, a fairly significant thing that takes a lot longer for us to deal with in humans. They're doing a lot of things with stem cells and things like that in horses that are just now moving in to human populations. And so when we finally get there, we've got that horse information, particularly with ligament injuries and things like that we can use in people.
Do you see the future of research including a look at some of these similarities?
I think it probably already does, and we're just starting to find out about it. I think the vets have, the horse vets in particular, have had a lot of experience in things that we're just now starting to realize are here in humans too.
And so you mentioned it started with a field trip, and you have your own horses. Is it something you continue to research yourself?
I do. I think probably one of the funniest things was when one of my horses had a cough, and I went to my car and got my stethoscope, and I was listening very diligently to see if she had a pneumonia or anything. And the barn manager said, "What are you doing?" I'm like, listening to her lungs, and he said, "That's not where they are." So, I've had to learn anatomy on a horse. It's completely different than people.
Certainly, and being a neonatologist, you deal with very small patients.
Yes,
quite a size difference.
And their lungs are very easy to find, but horses are in different spots. So.
Well, very interesting. Thank you so much for taking a look at that comparison with us. And as we mentioned earlier, you started Keeneland this week, so it is definitely horse season in the Bluegrass. All right. Thank you so much. We'll be right back.